So I'm a cancer doctor, and every day I see patients with cancer who have nausea from their chemotherapy or their cancer, loss of appetite, pain, depression, insomnia. And my experience over the past 30 years of being an oncologist is that there's one medicine that I could recommend to patients that can take care of all of those problems. Instead of writing 5 different prescription drugs, all of which have side effects and addictive potential, I can tell my cancer patients to try marijuana to take care of any combination of those symptoms. The first study that I really wanted to do was in patients with the so-called AIDS wasting syndrome, which was something we saw before the availability of active antiretroviral drugs, and patients with HIV infection just wasted away. They lost weight, they got diarrhea and fevers, and dronabinol, delta-9 THC, became available to help those patients increase their appetite. When we prescribed those patients dronabinol in the early 90s, they said, this is okay, but I really prefer to smoke real cannabis, because when you take cannabis by mouth, either as delta-9 THC or eating, in fact, baked products, the absorption is very slow and variable, so it takes about 2.5 hours for a peak to be reached, and the peak level in the blood is quite low, and then it stays in the body for quite a long time as well. Also, when taken by mouth, the delta-9 THC becomes converted by the liver to another psychoactive metabolite. So people that take dronabinol or eat cannabis baked products often get more zonk than people who smoke, because when you smoke, you don't get that second metabolite. Also, when you smoke, you get a very rapid peak in the blood in 2.5 minutes as opposed to 2.5 hours. So people can really control the onset of the activity and how long it lasts better if they're smoking rather than swallowing either a pill or eating a baked product. So our first study that we hoped to do in the early 90s was to show that smoked cannabis was better than dronabinol in increasing appetite in patients with the AIDS wasting syndrome. I tried twice to get cannabis from the government, because they're the only legal source of marijuana for clinical trials, and both times I failed. I then went to Alan Leshner, who at the time was the head of the National Institute on Drug Abuse, and he explained to me, in fact, that the government, NIDA, the National Institute on Drug Abuse, has a congressional mandate only to study substances of abuse as substances of abuse. So my request to have marijuana to study it as a potential therapeutic agent could never be granted by the government, because, again, Congress says you can only study these substances as substances of abuse and not as treatments for disease. So in 1996, the terrain changed when we got HIV drugs that actually worked, and we didn't see the wasting syndrome anymore. But these drugs were broken down by the liver by the same pathway that metabolizes some illicit substances. And there was a report in the literature of a patient dying from an ecstasy overdose who was on one of the AIDS antiviral drugs who took ecstasy at the same time. So I said, a little light bulb went off. I said, maybe I should study to see if it's safe for patients on the AIDS antiretroviral drugs to smoke cannabis. And so I submitted that grant to the government, and that worked within their schema because I was looking to see if it was harmful. And with that application, I finally succeeded and got $1 million and 1,400 government cigarettes to study in patients with HIV. Now, these patients didn't have the wasting syndrome anymore, but the endpoint of our study was, is there a change in the amount of AIDS virus in the bloodstream after 21 days of exposure to either 3 government cigarettes a day, or 3 dronabinol capsules, or 3 placebo capsules? And so we looked at the change in the HIV virus, and it didn't change at all. We also looked at the interaction between the cannabinoids, either smoked or oral, and the amount of AIDS drug in the bloodstream, and that didn't change clinically significantly either. We also knew that people were concerned that marijuana might have an impact on the immune system that could be negative. And we looked at that very carefully in these HIV patients, and we found no evidence of any negative effect, and perhaps some evidence of benefit in the immune system in patients smoking even more than taking the capsules. In my opinion, the whole plant is the medicine that nature provided, and it's the best medicine.